This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate. This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es el Senado Estatal de California.
This is the California State Senate.
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 Este es el Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
Esta es del Senado Estatal de California.
This is the California State Senate.
This is the California State Senate.
This is the California State Senate.
We're not taping yet, are we?
This is the California State Senate.
This is the California State Senate.
Okay, good morning, everyone. We're going to go ahead and get started. Today is the 15th. Boy, I need my reading glasses. And this is the Senate Committee on Health. We're going to do an informational town hall on the Zika virus for the California response. We're here at the Mark Taper Forum at the Los Angeles County Library. I'd like to first take the opportunity to thank the library for hosting us in this very beautiful facility. I also like to thank all those in the audience for being here and also the panelists for their participation. As chair of the Senate Health Committee, I've convened this informational town hall on the Zika virus and California's response due to the concerns over the public health risk of the Zika virus transmission and its effect on pregnancies and, more in particular, the community as well. This town hall is meant as a resource to disseminate information to the public. I believe California has been very responsive to public health epidemics, and together we can ensure we are going to do what we can to inform the public. With Congress recently unable to reach an agreement on future funding for the public health response to the Zika virus, it is now more important than ever that California is prepared to do everything possible to ensure that the individuals here in the state are protected. While Zika was first reported in Latin America, the virus is now hitting closer to home. Although there have been no reports of locally transmitted Zika in California, as of September 7th, the Centers for Disease Control and Prevention report 210 travel-associated cases in the state. So far, 2 babies have been born in California with severe birth defects, microcephaly, after their mothers were infected with Zika while traveling in foreign countries. And the 2 primary mosquito species capable of transmitting Zika are found in 12 California counties. I believe it's essential we fully understand the public health effects of the Zika virus and ensure that California is responding aggressively and appropriately. We have 3 panels today to discuss the Zika virus, the California's response to Zika, and community outreach on Zika. My goal is to provide resources to the community on the Zika virus and demonstrate how California is responding. it is important that our local community leaders, members of the public know about it and its potential impact on the local community. I'd like to introduce the first speaker who will share his insight on the Zika virus. We have first is Dr. Jeffrey Gutzenhauser, MD, MPH. He's Interim Health Officer for Los Angeles County of Public Health. And with that, I'd like to again thank you for being here, and I'd like to turn it over to you, sir.
Thank you very much. I do want to express my appreciation, Senator Hernandez, for arranging this session here. This really brings spotlight and helps us provide information. And also, I know you've been a champion in a lot of very important health and public health issues that we've all benefited from. So thank you very much for all you've done for us.
Thank you.
First of all, I just want to say I'm going to provide some basic information about Zika. Obviously, you've all heard of it, but I just want to make sure people have a basic understanding about what we know about this virus and the illnesses that can cause. So Zika is an infection that's caused by a virus that's spread by, primarily by mosquitoes. It can also, again, can be spread by sex with someone who's infected, and it can also be transmitted from a mother from a woman who's pregnant to her baby. But the primary way that it is transmitted is by mosquitoes. That's the way that most people are getting infected. So the first one I want to emphasize, as Senator Hernandez just said, is that at no time, at this point, there's no mosquitoes in Los Angeles County that are carrying the Zika virus or can transmit it to persons who are living here. So the only way that a resident of Los Angeles can currently acquire Zika infection is if they travel somewhere in the world where it's present, and perhaps if one of those individuals comes back and it's their sexual partner, they could pick up the infection from that individual. Now, for folks who have Zika infection, most experience no symptoms at all. This can be a silent infection, so an individual could travel to Central America, actually become infected. They could have that infection occur within their body. They could have no symptoms, have no awareness of it. They could come back to Los Angeles County. They could potentially transmit it to a sexual partner, having had no symptoms. They could potentially be bitten by a mosquito, which could set up some transmission here. And the only way we would know that they were infected is if they had a blood test. About 1 in 5 persons, about 20%, a small proportion of those who actually get the infection develop some type of symptom. And those are generally either fever, having some type of muscle or joint aches, a bumpy red rash, or they could have pink eyes. Those are the most common symptoms that an individual have. However, I do want to point out there's a number of other illnesses that can cause similar symptoms. Some of you may recall that not very long ago here in Southern California, we had a measles outbreak. So children with fever and rash could have measles. You also know we're heading into influenza season. So adults who end up with fever and have body aches, it could very likely be that. Or it could be meningitis, which is another condition we're having challenges with here in Los Angeles County. So there's no way for an individual, even someone who's traveled to a location where the virus is present, to discern whether their symptoms are due to Zika or something else. So we encourage people who think they may have it to see their primary care provider and to have a blood test performed to help sort that out. As I said, the infection is generally not severe, usually without any symptoms, and if you do have them, they last about 5 days. Once a person fights off the infection, in general, they get better, they have no symptoms after that, and they're probably immune. There's some risk that they could transmit it sexually for a period of time after that infection is over, and of course that's still being looked at. Rarely people get other serious complications from this, but like I said, they're very, very rare. The most important consequences of Zika infection, the ones that we're most concerned about, as Senator Hernandez highlighted, occur when a pregnant woman is infected. This is because infection during pregnancy may also lead to infection of the baby. This is serious. In about 1 in 10 of these babies, the infection can interfere with the development of the brain, resulting in the baby being born with a small head. You've probably seen photographs of this. It's a condition called microcephaly. But there are other conditions that the virus can also cause in a baby, such as loss of hearing, loss of vision, and other things. So I want to emphasize that not all women who are infected during pregnancy will come down. Most won't. But 10% or so can have these serious complications. this is a serious problem. So this is something we all want to prevent. Because of this risk to the unborn baby, women who are pregnant really should not travel to places where Zika is being spread. That's my recommendation. That's if she talks with her healthcare provider, she would probably hear the same recommendation. So again, I just want to emphasize, we're really recommending those who are pregnant, may be pregnant, or trying to get pregnant, to avoid travel to locations where Zika may be present. However, I do realize there are some situations where people do decide to travel. They want to share the joy of their life. They might have a certain family event. Maybe they just got married or some other things, and they want to visit relatives in locations where the virus is present. So in those cases, I really recommend that a woman take very severe precautions to protect herself from becoming infected while she visits those. And there's generally two things that you can do. One is stay in a location where the mosquitoes aren't present. So stay in someone's home or a place where there's screens and air conditioning and the mosquitoes can't get in there. And if the individual needs to go outside, then take measures to prevent the mosquitoes from biting you. So that would be wear loose-fitting clothing that covers the arms as far as possible and the legs, and any place where the skin is exposed, to use some type of repellent that's approved by the Environmental Protection Agency. You've probably all heard of DEET, picaridin, and some other repellents that are effective in repelling these mosquitoes. So if a woman travels to a location, I really strongly encourage her to take those precautions. But again, the most effective form of prevention is to not get exposed. So I recommend not traveling there at all. Now, in order to make that decision, you have to know where the mosquito and the affected mosquitoes are. So most people that go to LA County that have gotten infected have gone to 4 countries in Central America, and those are Guatemala, El Salvador, Honduras, or Nicaragua. So when we look at over half the cases that we have been in individuals who traveled there and back. So far, we've had 67 people from LA County, and they've gone to other places as well. They've gone to Puerto Rico. There have been places in southern Mexico where they've traveled to, and other countries in Central and South America. The list of locations continues to expand. So if people are planning any kind of trip outside of California, I'd recommend they go to the CDC's travel website, and it's a very accessible location there. You can quickly find out if the country to which you're traveling is affected by Zika virus. I really do want to particularly get the message out to close friends and family who have close friends or family in these countries, particularly in Central America. So I know it's important to be very close and perhaps to share, like I said, some of these happy occasions, but I really do ask everybody to collectively think about the risks and, if all possible, to avoid travel so that the consequences that can occur in pregnancy can be totally avoided. I do want to mention a few things about the transmission of the virus through sex. If a man or woman has traveled to a place where Zika is present, as I said, they could have a silent infection, not be aware, can come back, and for a period of time there's some chance they could transmit this to their sexual partner. This isn't very common. It occurs more often from men to women than from women to men, but it can occur whenever sex is happening and one of the individuals is infected. So, and even if you don't have symptoms, right, that's not a marker for safety. If you've traveled, it's been recent, you could be infected, you could have no symptoms, you still could transmit the virus sexually. So it's important for people to keep that in mind. So what we advise is that for example, a man has traveled to a place where there's Zika, and he has a partner, they're trying to have a baby, or her partner is pregnant, well, I really recommend deferral of any sexual contact for a length of time for the man until he would not be at risk of transmitting it. But if the woman is pregnant, defer sex completely or use some type of barrier such as a condom, so that if a man has the virus, he won't transmit it to the woman during pregnancy. I do want to just go back for one more second and talk about mosquitoes, because that's how most of the Zika is being spread, and you'll hear more about that from the other individuals up here. But I want to say again that mosquitoes in Los Angeles County are not infected. But if you travel to a country in Central America or elsewhere where Zika is present and are bitten by an infected mosquito there, you could get it and bring it back here. So with this in mind, I ask everyone who's traveling to a place where Zika is present to be aware of this, and perhaps just on the basis of that, the possibility of bringing it back, to consider deferring travel. But with that in mind, if you do travel, regardless of if you're a man or a woman, to take those precautions to prevent getting infected while there. So again, stay indoors, screened, or with air conditioning, wear long clothing, and use some type of repellent. And also, when you come back, there's a chance that this individual unknowingly could have Zika infection. And if a mosquito here in LA County bites the individual, it could begin a string of transmission like that's happening in Florida today. So what we recommend is after you travel and you come back to LA County, take the same measures for a couple of weeks to prevent mosquitoes from biting you. So that will prevent the transmission of the virus from yourself to other individuals. So let me just summarize the key points. Zika is spread primarily by mosquitoes, but can also be spread through sex or from a pregnant woman to her child. Most people with Zika have no symptoms, but for those who do, the infection is generally mild with fever, aches, a rash, and perhaps some red eyes. Pregnant women who get Zika may pass the infection to their unborn baby, leading to brain damage, a small head, or other serious consequences. The best way to prevent getting Zika is not to travel at all to countries where the infection is being spread, particularly important for pregnant women. Because Zika is spread primarily by mosquitoes, if you do travel, take the preventive measures that I already highlighted. And Zika is also sometimes may be spread by sex with someone who's infected, so men who travel to a place with Zika should use a condom or abstain from sex if their partner is pregnant. And to keep Zika out of LA County, people who do travel to an area should avoid getting bitten by mosquitoes for a couple of weeks after they return. Thank you very much for your kind attention.
Thank you. We're going to go ahead and move on to the next presenter. That's the California's response to Zika. That's Dr. Benjamin Schwartz, MD. And I will go, and then after that, we will have Jason Farned as well as Ken Fujioka from San Gabriel Valley Mosquito and Vector Control District. So at this point, I'll go ahead and turn it over to Dr. Schwartz.
Well, thank you very much for the opportunity to share the public health response to Zika infection. In my remarks, I mostly will be talking about what we're doing in Los Angeles County, rather than speaking for the entire state of California. But having had conversations with the California Department of Public Health, as well as with other county health departments, the steps that we're taking are very similar to those that are being used across the state. As a new disease threat to residents of Los Angeles County, we're doing many things to protect people from Zika and from the serious consequences that may occur, particularly with pregnant women and their infants. So let me share with you what those actions are and how you can protect yourself and your community from Zika. The overarching goals of the public health response to Zika are to prevent Zika infection, particularly among pregnant women and their unborn babies, to prevent Zika from being spread in Los Angeles, as currently it is spreading in other countries and now also in some areas of Miami, Florida. In other words, we have to keep Zika from getting a foothold in Los Angeles. And also, our goal is to support women, infants, and their families who are affected by Zika. So how are we going to accomplish these goals? A key part of our strategy is to educate and inform doctors and other healthcare providers so that they know the signs and symptoms of Zika and correctly diagnose and report patients who have Zika infection. To do this, doctors need to know where Zika is spreading, what the illness looks like, and who should have a laboratory test for Zika. And this will include some people who are totally well, who don't have any signs or symptoms of illness whatsoever. Even though there is no drug to treat Zika, knowing who has infection is important, so that if the person with Zika is a pregnant woman, we can follow her through her pregnancy, give her advice, and make sure that the baby doesn't have any complications. Or Identifying who has Zika also is important, whether pregnant or not, so that we can educate patients on how not to spread Zika to the mosquitoes in Los Angeles County and potentially to others in their community. And I'll talk more about this in just a couple minutes. To educate healthcare providers, the Department of Public Health has sent out information through the Los Angeles Health Alert Network, and California has used the California Health Alert Network to inform physicians. We've communicated by emails, distributed materials, and made presentations at professional conferences. And we're continuing to work to get that word out and to share information that will help doctors and other clinicians do a better job. When a laboratory test for Zika is positive, that information is sent to our program at the health department, Acute Communicable Disease Control. And this is what we call disease reporting or surveillance. And these reports are very important because they enable us to do several things. First, by collecting and analyzing disease reports, we can provide information to the public that can help prevent disease. For example, we can share information about what countries carry the greatest risk, and as Dr. Gunzenhauser mentioned, currently those are countries in Central America. And so if people are thinking about traveling to the countries, they can make an informed decision about whether to go or postpone their trip, and certainly if they go, to use mosquito protection. Second, public health tracks pregnant women who are infected throughout their pregnancy and for the first year of life after the baby is born to learn about what problems may have occurred, and if there are problems, to link those mothers and families with the appropriate support services. And third, we use the information on where people with Zika infection live to guide mosquito and vector control agencies to look in the nearby area for a certain type of mosquito called an Aedes mosquito, which is the one that spreads Zika infection, and to help residents in that area keep them free from these dangerous mosquitoes. And let me expand on that point because it's really important. We do not want to end up in the same situation that Miami is in right now. So currently, no mosquitoes in Los Angeles County are infected with Zika, and no Zika cases have occurred in LA County residents who either have not traveled to a country where the illness is present or have had sexual relations with a traveler. However, if someone comes back infected with Zika and then is bit by an Aedes mosquito, they may infect that mosquito, which then could bite someone else and spread the disease. And that's shown in the pictures on the slide. So on the left, you have someone with Zika, then this dangerous Aedes mosquito can bite them, and then bite someone else, potentially a pregnant woman, and the disease could spread here. And this is the sequence of events that is going on right now in Miami, where people who have never traveled are at risk of Zika, and so really it's important for that not to occur here. Therefore, when we find out about a person with Zika who lives in an area that has Aedes mosquitoes, we communicate with our colleagues in vector control, and they go to that area and inspect backyards to see whether the mosquitoes or their eggs are present. And if they find mosquitoes, they can treat to get rid of them, reducing the risk that disease will spread here. And as I mentioned, in the next presentation, Jason will talk more about this kind of work. We also have mapped where Aedes mosquitoes have been found in LA County. And this is shown on the slide in the red and blue dots. So those red and blue dots indicate two different types of Aedes mosquitoes that can carry Zika. The black triangles on the map are the locations where we have found Zika cases. And you can see that in several instances, those triangles, the Zika cases, are in the same areas of the county where the Aedes mosquitoes are. So clearly, there is a risk that someone could be bitten and that the disease could begin to spread here. And so we are doing everything we can to minimize that risk. And while Jason will probably say a lot more about what the inspections are finding, it's important to point out that keeping Zika out of Los Angeles is not only the work of people who travel and are infected, but it's the work of all of us. And we need to clean up our backyards and make sure that there are not places where these Aedes mosquitoes can breed, because that increases the risk for everybody, for our communities. While we're working hard to prevent Zika from getting a foothold in Los Angeles County, it is possible that despite our best efforts, local mosquitoes will become infected and that disease will spread here. And obviously this would be a threat to pregnant women as well as everybody throughout our community, as well as having significant economic impacts if people stopped traveling to Los Angeles because of the risk. So to be able to address this risk, public health has been working with other departments and organizations to develop a preparedness and response plan that would guide our response and would be activated if local spread of Zika occurred. This would guide the response of public health, emergency response, vector control, and other agencies. We would identify where the spread is occurring and how extensive it is, work to kill the mosquitoes that are spreading disease, educate the public about how they can protect themselves, and identify and support pregnant women who are infected. The plan also will include strategies to prevent infections for high-risk populations. And I was participating in a town hall a short time ago, and one of the questions I got was, what about homeless people who can't go inside, who don't have screens on their windows? And so this plan will address that issue of how we can protect the homeless by using mosquito repellents, for example. We hope this plan will never be needed, but certainly it is much better to be prepared than to be caught unprepared. But let's go back to our current situation where Zika infections are occurring among people who travel to a country where Zika is spreading. In order to prevent disease, one of our most important tasks is to communicate with the public, to provide education, and encourage people to change their behaviors to reduce the risk of Zika infection. As Dr. Gunzenhauser emphasized, some key messages are that people, especially pregnant women, should reconsider their travel, and if they do travel to a country where Zika is present, to take steps to avoid being bitten by a mosquito. And there are many ways that we're working to get this information out. We've had news conferences, talked with reporters, participated in forums such as this one. We've developed informational videos, developed and provided written materials, posted information on our website, trained public operators on the 211 call line to respond to questions from the public, and worked with consulates of countries that have Zika to share information with their communities. In addition, there are signs posted in the international terminal at LAX warning travelers and providing information on preventing Zika infection. And there are signs at immigration for returning travelers, posters and video messages that will provide advice to pregnant women on being tested, as you can see on the slide, and then also provide advice that for 3 weeks, returning travelers protect themselves from mosquitoes so that they don't get bit. One of our most effective communication strategies, both to educate people and to get behavior change, is to hear about the problem from your neighbor, from your family, from others in your community. So I'd encourage all of you who are here today also to share what you've learned and what you heard with others in your community so as to stop this infection and to prevent it from spreading here. Another important opportunity to prevent serious effects of Zika infection on newborns is to ensure that women who do not want to become pregnant have access to effective contraceptive methods to prevent an unwanted pregnancy. For example, if a young woman has a family in Guatemala and will be traveling back and forth, and she's not planning on becoming pregnant, having access to effective contraception would be important to protect her and to make sure that she doesn't have an unwanted pregnancy. Or if she is not the one who's traveling, but perhaps it's her partner, using contraception would protect her from having an infected baby, and if her partner was infected during travel. So it's important also to emphasize the availability and access to contraceptive methods. So far, I've focused most of my remarks on preventing Zika and the local spread of Zika infection, we know that an ounce of prevention is worth a pound of cure. But despite our best efforts at prevention, some pregnant women will travel to areas where Zika is spreading, and some of them will become infected. So far, out of the 67 people that Dr. Gunzenhauser mentioned have been infected in Los Angeles County, 11 of them have been pregnant women. Some of these women have delivered, and some of them are still pregnant. While most infants born to mothers with Zika will be entirely normal, some of them will have severe birth defects, such as microcephaly from abnormal brain development. During pregnancy of a woman who's infected, our program, Acute Communicable Disease Control, will follow up with the woman and her obstetric provider to track the progress of her pregnancy and ensure that at delivery, the right specimens are taken to identify if the baby is infected. Then we turn over the follow-up to Public Health's Maternal, Child, and Adolescent Health Program, which will contact the mother at 2, 6, and 12 months to check and see how the baby is doing, and report this information to a national pregnancy registry at the Centers for Disease Control and Prevention. And then finally, if at birth the infant is found to have microcephaly or some other birth defect, or is at high risk, that child will be enrolled in the high-risk infant follow-up program of the Division of Children's Medical Services and may receive diagnostic testing supported by California Children's Services to identify if any problems are present, and then if problems are found, to support the mother and the family, again, potentially using resources from California Children's Services. And I'd particularly like to thank Senator Hernandez, who's been instrumental in his support of California Children's Services. So thank you very much for that support. What I've shared with you today is the current information about what public health is doing to keep LA County safe from Zika. But the final message I'd like to give you is to stay up to date. As we learn more about Zika and as the global situation changes, the information that we share and the approaches that we take may change. We're constantly updating information on the countries that are affected, and if I were giving this talk, say, a month ago, I would not have mentioned that there was infection in Miami, but now we know that there is. And so it's really important to keep up to date and to know what the current information is. So on the slide, you can see the websites for the Los Angeles County Department of Public Health and the Centers for Disease Control and Prevention. And I would encourage you to occasionally check these websites to learn what is new with Zika infection. So thank you very much.
Thank you. We will move now to the next panelist. We'll have Jason Farned as well as Ken Fujioka from the San Gabriel Valley Mosquito and Vector Control District. Do you have PowerPoints? There you go. Thank you.
Great. Good morning, everyone. My name is Jason Farned from San Gabriel Valley Mosquito and Vector Control District, and we're very happy to be here because we feel that community organization outreach is critical in not only preparing for but preventing mosquito-borne disease. So I'm going to talk to you a little bit today about what mosquito and vector control districts do and how we fit into this process. And then I will talk about our Zika response. And then I want to talk directly to residents about how they can help protect themselves and their families and their communities. So San Gabriel Valley Mosquito and Vector Control District is one of many special districts throughout California that manage mosquito and vector control. Here in Los Angeles County, there are 5 such districts, and each district is managed independently by representatives of its member cities, and each district operates to address the specific concerns in their specific area. So usually when I start describing what mosquito and vector control does, the first question I always get is, what is a vector? So let's quickly get that out of the way. A vector is any organism or animal that transmit diseases to humans or is considered a severe public nuisance. So in San Gabriel Valley, there are 3 primary vectors of concern that the district manages. The first 2 are nuisance vectors, black fly and midge. But the third is the most dangerous animal in the world, and that's the mosquito. If you take a look at this chart that lists some of the most dangerous animals on Earth, we start with sharks. They kill approximately 10 people a year. And the list goes on, and then there are snakes at the bottom there that kill 50,000 people a year. If we bring in the next dangerous animal, Surprise, it's humans. We kill ourselves at a rate of roughly 475,000 people a year. But by far the most dangerous animal, killing more humans than any other animal or all the other animals on the planet combined, is mosquitoes. Mosquitoes kill between 700,000 and 1 million people every year. Now, whenever I talk about the statistics, most people are usually surprised, and I think that it's because in this country, public health agencies, sanitation practices, education, and infrastructure significantly reduce mosquito-borne diseases. And we don't have it nearly as bad as people in other places of the world, but that still doesn't mean we have nothing to worry about. Here in California, for example, our most common Culex mosquito transmits a lot of dangerous diseases. West Nile virus is one of those. West Nile virus is the most predominant mosquito-borne disease in California. Last year, there were 783 reported cases, resulting in 53 deaths. And this year, those numbers are projected to be much higher. And the reason I bring this up is because when you try to battle a specific mosquito-borne disease like Zika, many of the things that you do work across the board to prevent all mosquito-borne disease. And there's a very important point that I like to reiterate here, and that's that different mosquitoes transmit different diseases. And the reason that that's important is because all over the state, we're starting to find invasive species that aren't native to California. And with those invasive species, they're bringing viruses and diseases that the state of California and the people who live here have never had to worry about before. An example of that is a group of mosquitoes that we've discussed here today that we're calling invasive Aedes mosquitoes. And these are the mosquitoes that transmit viruses like Zika, dengue, and chikungunya. So I'm going to talk about Zika specifically really soon, but I think it's really important that we learn a little bit more about the specific mosquito that spreads the disease. In this way, this will not only help us address Zika, but also any of the other diseases that these invasive Aedes are capable of transmitting. So invasive Aedes are very different from our native mosquitoes, and they have many unique characteristics. And probably one of the most obvious characteristic is that they bite aggressively during the day. And this is something that people in California are not used to. We're not used to having to put on mosquito repellent before we go to the beach or lay out by the pool or play with our kids in the park. And people who are living in the neighborhoods where these mosquitoes are already living have said that they've had to greatly change the way they use outdoor spaces because of these aggressive day-biting mosquitoes. Another important distinction is that these mosquitoes bite multiple hosts per blood meal. And this is important for two reasons. The first reason is that it makes them much more efficient at spreading disease. But also it means that one mosquito can be responsible for several mosquito bites on one person or multiple people, meaning that their nuisance factor is much greater. There are several other differences, but the one that is probably the most important and one that I really want to highlight today is that these mosquitoes are considered container breeders, which means that they prefer to lay their eggs in very small, usually man-made containers, most likely found in backyards or in urban areas. The other thing about this that makes these mosquitoes so difficult to manage and almost impossible to eradicate once they become infested in a certain area is that they lay their eggs in singly in individual containers. So they don't lay their eggs all in one place. And those eggs are extremely durable. They can lay dormant for several months, maybe even a year or more, just waiting for the right conditions to hatch. So if you think about that for just a second, our common mosquitoes lay eggs in rafts in maybe 100 or 200, maybe 300 at a time. If we find those egg rafts, we can remove the water, treat with pesticide, and we have killed that entire brood of mosquitoes. This mosquito lay their eggs individually all over the place. So not only do we have to find those individual eggs that are smaller than a grain of sand, but we can't just remove the water or treat with pesticide because those eggs can lay dormant waiting for better conditions. And if all of that isn't bad enough, these mosquitoes can also live their entire life cycles indoors. So people are finding them in their homes and offices. So what are we doing about it? Since 2011, when invasive Aedes started its aggressive expansion in LA County, we have dedicated significant resources to developing a program specifically addressing this particular threat. Even though there has been no local transmission of any Aedes-borne diseases in California, we know that we are only one mosquito bite away from such an event. We have a surveillance team dedicated to finding, collecting data on, and eliminating invasive Aedes mosquitoes. Every day, we conduct door-to-door inspections and perform targeted treatments. We have a wide range of education programs available, and part of our comprehensive integrated vector management strategy, when necessary, we conduct larger-scale neighborhood truck-mounted pesticide treatments. All of this happens whether there is local disease transmission or not. But here is how our program has been enhanced in light of the more recent Zika threat. We are in the process of developing a multi-agency readiness and response plan. This effort has been led by the County Department of Public Health, and they have done an amazing job bringing together all the appropriate agencies and organizations. We are now investigating imported Zika cases as reported by County Health. And this is giving us an opportunity to use these investigations to implement and test the CDC response protocol. So when there is, or if there is, local transmission, we'll be ready. We are actively searching for invasive Aedes outside the current infestation area, and we have begun testing samples of invasive Aedes mosquitoes trapped in the field for infection of Zika, dengue, and chikungunya viruses. Despite all of this, however, the threat of Zika transmission is still very real, and there is a level of responsibility and participation that all residents need to take to help protect themselves, their families, and their communities. So first off, because there is no vaccine and no cure at this time for Zika, mosquito bite prevention is key. Wearing an effective insect repellent when and where mosquitoes are present is critically important, especially when traveling to areas where local transmission of Zika is taking place. Wearing protective clothing will help. I hate telling people when it's 100 degrees outside that you should wear long sleeves and long pants, but if you're in an area with day-biting mosquitoes, and especially if you're in a family situation where you're planning on starting a family or getting pregnant, it's very important to wear protective clothing, long sleeves, light-colored, loose-fitting clothing. It's very important that the screens on your windows and doors fit tightly and are in good condition to keep mosquitoes out of the house. And probably the most important thing, again, that I could reiterate today is to dump and drain standing water. Finding the sources where these mosquitoes are laying their eggs and growing will help reduce populations. So this is what I mean. And this is a good example of part of how challenging this particular mosquito is. These are examples of common breeding sources that we find. And as you can see, this is common stuff that's found in everybody's backyard, regardless of landscaping or cleanliness. And I don't really have time to go through all of them, but I would like to point out the bromeliad as a good example. The bromeliad is a plant that naturally holds water. And when invasive Aedes were first introduced into LA County, we warned people about bromeliads and told people if you had them, you should probably keep an eye on them and inspect them regularly. But the situation has gotten to the point now where we're telling people that it's probably better just to remove them altogether. If you can't manage them on a daily basis, then it's probably better just to get rid of them. And that's the case with a lot of these sources. Any one of these things might be okay to have in your yard if you're willing to go through it every day or every few days and expect it from mosquitoes. For most of us, that's unrealistic. So the goal is to find these things where mosquitoes grow and get rid of them altogether. Mosquitoes will grow in any container that holds water more than a teaspoon or so. It doesn't take much at all. And the most dramatic example I can give you is this. These are bottle caps that we found in the corner of someone's yard. On the left, if you can see, is a closer picture. These bottle caps were just full of sprinkler water, and we find mosquito larvae comfortably living in bottle caps. We've also found them living in debris and trash, chip bags, even empty snail shells, anything that will hold water. So there are a lot of things that individual residents can do to help reduce the population of mosquitoes. Another specific characteristic of this mosquito is they have a fairly short flight range. They only fly about 1/4 of a mile, which means that individual households and individual neighborhoods have an extreme amount of power in reducing the population of mosquitoes in their direct vicinity. So the first thing that I suggest that all of us do when we get home today is inspect your property to keep mosquitoes from growing at your house. Alter landscapes to be less inviting to mosquitoes. Cut back overgrown vegetation where mosquitoes rest. Remove bromeliads and other plants that hold water. Remove non-functional water features and fish ponds. And modify, maintain, and regularly inspect rain barrels or other rain collection devices. Due to the drought, a lot of people have been getting rain barrels collecting rain, and we're finding that most of these are breeding mosquitoes when inspected in the field. There's not a single rain barrel on the market that I have found, and I've done some pretty extensive research in San Gabriel Valley, that are completely mosquito-proof. There's no rain barrel that doesn't need any modification or regular inspection. And lastly, regularly inspect your property for standing water, especially after it rains. The next thing that I'd like everybody to do is share what you know. Share this information with your friends and neighbors. We have door hangers and educational material available free of charge. So if you don't want to speak to your neighbors directly, you can leave something on their door or throw something on their porch. Also, visit our website when you have questions, sgvmosquito.org. And follow us on Facebook and Twitter. Like Dr. Schwartz mentioned, especially with Zika, things are changing every single day. And social media is a great way to stay up to date. And lastly, we are a public health agency and we are a resource to the community. And we want everybody in the community to use the resource. So call the district. We provide free mosquito fish, which can be put into ponds and lily pots that eat mosquito larvae. You can schedule free property inspections or rain barrel consultations. And there's also people available to answer any questions that you might have. Always call and report any standing water that you see around the neighborhood, in drains or gutters or public spaces, and report green swimming pools. Swimming pools aren't a big source for invasive Aedes. They prefer smaller sources of water, but one green swimming pool can produce up to 3 million mosquitoes in 1 month, enough to ruin the summer for an entire neighborhood. And lastly, the best personal protection I can recommend is to wear mosquito repellent. Buy a bottle of mosquito repellent, have one outside your front door and outside your back door, and as soon as you leave the house, especially if you're in an area currently infested with invasive Aedes, throw on that mosquito repellent every time you leave. Thank you very much.
Thank you. We'll move on to our last present. No presenting? Okay. Well, first of all, let me take this opportunity again to thank all of you for being here. I have a couple questions, but I'd like to also announce to the audience that we have some comment cards that are going to be available. If you would like one, just raise your hand and we'll have the staff. We have Susan back here that can pass them out if you'd like to ask a question after we're done with the next panel. So I understand the process. There's no cure at this time for the virus. My understanding is the Aedes mosquito that is more likely to carry it, and with regard to the Zika. So a couple of questions I have. One that comes to mind is, I think Dr. Jeffrey Guggenheiser, you had mentioned that somebody can get infected, they go through the symptoms, then they become immune to it. Is that correct? But yes. Do they become immune for life, or is it just immune for a short period of time? And how long is that immunity?
It's a very good question. So I think the answer is we don't know. Perhaps Dr. Schwartz could comment on that, because Zika's are relatively new. Even though it's been known for decades, research focusing on understanding this disease completely has been very limited. So, we can track if a person's been infected and track to see if they have antibodies in their blood, and probably we'll see that those persist for years. In general, if a person has a natural infection, those types of infections generally do provide lifelong immunity. If you get measles once as a child, it's unlikely you're ever going to get it again. So it's more often that we have vaccines where they don't provide lifelong immunity, although they're very effective. Occasionally there's a small percent. So I would say the answer is we probably don't know. I think we can extrapolate from other diseases. For example, there are other related diseases such as dengue, which is similar in a number of ways. It's transmitted by the same mosquito. It's in the same locations where this disease is present now. And we have been studying, and the world has been working on developing vaccine for that. What we do know is there's 4 major serotypes. There's been some work. We do know that if a person does get one of those serotypes, they generally are immune for at least a long period of time, perhaps lifetime, from getting that particular serotype, but they could get one of the other. So dengue is a little bit complicated, but I think if we extrapolate from what we know of those, I would say there's a very high probability you're immune for the rest of your life.
Okay, thank you. And obviously, there's no vaccines available right now, and that will kind of lead to my next question. If it's important that we, number one, educate the public to wear repellents, to, if you're planning on becoming pregnant, not to go to an area where there could potentially be Zika, et cetera. But what if a young woman goes to an area that gets pregnant and gets infected, comes back, there's a dormant period of time, and I guess what it led to that period, do we know at all when is the safe distance of time that we have that if someone were to get pregnant, will it still be transmitted, or is it more likely that it'll be transmitted immediately after inoculation? Any indication of that, when that might happen?
The virus infects someone for a relatively short period of time. So the CDC says that a woman who is infected or who has traveled to an area where she might have gotten infection because she could be asymptomatic and not even know, that she could get pregnant 8 weeks after her travel. Now, men, if they become infected, may have the virus in their semen for a longer period of time. So CDC recommends that if it is the man who traveled, that the couple wait before getting pregnant for a longer period, perhaps 6 months or more. And we're still learning more about how long that period should be.
And I guess the reason why I'm highlighting this particular area, yes, it's true that there's no vaccine. It seems that if an adult were to get it, there'd be an incubation period. They get the typical, fever, rashes, et cetera. But there's nothing that would indicate that that person would have any kind of long-standing health effects for the future. My biggest concern is how do we prevent adults to make sure that their children in the future or their children that they're planning don't have, because you had mentioned it's a much different scenario. If a child is born, I believe you had a statistic, only 10% have complications, but that 10%, we don't want that to even be at 10%. With that line of questioning and going down that direction, what do you think can be done by government, whether it's state, whether it's county, city, or local, to make sure that we get that message out to potential parents that are looking to have children? What are some of the ways? And I know, Jason, you had mentioned the multi-agency response. How is that all working right now with regard to the multi-agency response?
If I could just address the first part of your question about how are we getting the word out. And this also is part of our planning process. We're identifying where women go for their prenatal care and also for their regular medical care. Someone who has a young child may have a subsequent child, a subsequent pregnancy. So First 5 LA, for example, might be a place to get the word out. organizations like Planned Parenthood that may see women who are pregnant or who are using contraception so that they don't become pregnant. So those would be good organizations. We need to do a better job identifying communities of women who come from the countries where Zika is spreading. So certainly understanding who are the influential communicators and organizations that serve these communities is something that we are trying to continue to get better at. And so I do think it's important to get the word out that not only are women who are currently pregnant at risk, but also there may be some risk if you become pregnant shortly after you return from travel, and that's a message we have to communicate.
Okay, Jason, anything? I mean, explain to me how your multi-generational agency response is working and how we tie all, whether it's federal, state, and county, and cities all together.
Sure, all of that is being developed at this time. When you get so many different agencies together in the same room, it takes a while to iron everything out, which is why we're trying to get ahead of any local Zika transmission. But probably the biggest thing that's come from our multi-agency response is just the sharing of information and the sharing of resources and knowing exactly what type of resources are available in different agencies so that when there is any kind of threat, what type of resources and what type of help you can leverage or get from other agencies. As far as community education goes, the vector control agencies work on a very local level. They work at the city level and do education and outreach presentations, health fairs with the cities. We're currently working with individual cities to try to get mosquito on the radar of the cities. So that way code enforcement and different departments within each city are also helping us look for mosquito breeding sources and making sure that things that are breeding mosquitoes can get fixed in a quick way. And we're also making sure that mosquitoes on the radar as policy decisions are made. So as policy decisions are made in regards to water conservation, for example, that there is a voice in the room that talks about concerns of mosquitoes and mosquito breeding.
Let's talk a little bit about resources. Obviously, we know at the federal level it's difficult right now to get the resources for some of the funding for the various states for this. Obviously, this is something we need to lobby our federal legislators and Congress and the Senate as well. What do you think the role of the state of California should be? How should we be looking? Is there a significant amount of resources? Is there enough resources, or is there not enough resources? Is this because representing the state Senate, even though I'm one of 40 state senators, but I think in being chair of the Senate Health Committee, this could have effect on the whole state. And do we need to look at allocating resources through the state budget and work in collaboration with our federal partners? With regard to the resources, is it sufficient, or do we need to be looking at more as far as funding?
I think additional resources really are needed. Emergency preparedness is sort of at the center of this. What is our capacity and really what is needed? I think you're aware that some of the emergency preparedness funding that we had here for LA County was pulled back by the federal government and redistributed into other things. Some of that came back as a small proportion to LA County to support some of our work, but there's really been a net loss of some of the resources. And where this affects our ability is, we do the epidemiology work, that is finding where the cases are, getting the history, and making sure all that information is correct. There's an awful lot of laboratory work that needs to be done. I really can't underestimate the incredible amount of work that's created. Many people are concerned. We've got nearly 30,000 licensed doctors. They're calling us for information. There's been a tremendous growth of Zika tests in the community. It's now in the commercial sector, and trying to coordinate all this so we can actually interpret it and make sure we've got accurate information is challenging. We have very limited resources on our department, and just that piece so that we can inform individuals and the county about the status is very, very challenging. I think that we're going to learn a lot as a nation about how effective our vector control strategies are, and I would defer to my colleagues here, but I do believe that we're going to find techniques that can be more effective. Relying on individual behavior is the last defense of protecting a disease. So if we have to educate people and inform every traveler about the risk and what they need to do, it's not a very effective strategy. But if we have more general community strategies that are administrative or engineering in nature, we're much more likely to be effective as a community. I would expect that over time we are going to identify strategies that are more effective at controlling the mosquitoes so that we would eliminate the risk. But that's going to take resources, right? We have very limited resources. In our work with the districts here in LA County, I've been extremely impressed at what they're able to do with their limited resources, but I'm sure that they can do more. And then there's the general need for education campaigns. We do work closely with many partners, as Dr. Schwartz mentioned, in trying to get the word out as much as possible. But there still are hundreds of thousands of people, perhaps millions, right here in LA County who still don't understand the fundamentals, what the risks are and what they can do. And over time, as we educate more and more people, the word will get out, but it takes time. But in the short term, to do that, we really have to have more resources to reach out to every potential affected community. If we could go out through the faith-based organizations, other leaders that represents the really at-risk communities, we could more effectively get that out. But it does take some resources to do that work as well.
Thank you. I know you had earlier, I believe, Jason had a slide up with regard to the areas where the Aedes mosquito was. When you find a concentration of those particular, you'd mentioned you go in there a lot more aggressively. Tell me a little bit about spraying. Is there been any kind of pushback from the community with regard to spraying, and how do you educate them on the outweighing the risk factors so that, you know, nothing does happen in the future?
I can answer that question. We received very little pushback. Currently, what's driving our residents' concern is the nuisance factor. We're literally getting hundreds of requests for service by phone. And when we do the inspection and we find the mosquitoes, the residents are looking for relief. And so there's very little resistance. The pesticides we use are transient. The ones targeting the adults disappear very quickly. The ones that we use that target the larvae are very target specific, and so they don't, they're certified for use in organic crops, for example. Okay. We have done truck-mounted applications of pesticide. They're based on the number of mosquitoes that are present in an area and what we're trying to do is knock down the adults to a sufficient level so that the risk is reduced. And so our decisions to apply pesticides are based on science. They're not random applications. They're not on a routine. They're based on a need.
Okay, and obviously we've been hearing a lot about the Zika virus in the news with, you know, the unfortunate pictures of the children that are being born. Have either of you or any of you seen more bigger uptake of concern by residents from the area, the county, the state because of it? Have you guys been getting more calls?
Yeah, we do. So there's great concern. We have 120 or 125,000 births in LA County a year, and you can imagine many of these residents have families in parts of the world where this is present, so there's tremendous concern. I think we've gotten the word out pretty well. We do get calls. We're able to field some of those, but one of the biggest concerns is around testing. You can imagine with the number of births and the number of people who travel and perhaps other exposures, there's many women who really would like to be tested and perceived that they're at risk and want to assure that that's not the situation. So we do have some capacity. I know Dr. Schwartz fields some of these. We also have an obstetrician in our department who's helping us with a number of these issues. But we've seen a lot of calls come in and a lot of concern about this issue.
Okay, thank you. Let's. So we do have some questions from the audience. Question is number one, do we have any breakdown in age or race or of confirmed cases? I don't know who can answer that.
We don't want to share information that could be personally identified, but I will say that the large majority of the cases are among Latino people, and that reflects where the disease is present, where the disease is spreading. So in Los Angeles County, over 3/4 of the Zika cases have occurred among Latinos. They have occurred among people who live in all parts of the city. So there is no part of Los Angeles County that seems to be spared of having people with Zika infection. And then they are various ages. There is one child, there are several adolescents, young people who travel. It really spans the gamut.
Okay. Next question, have there been any cases confirmed in the San Gabriel Valley?
There have been, and in one of the maps that I showed where those black triangles represented the locations of Zika cases, there were some in the San Gabriel Valley, there were some in the San Fernando Valley, and then in the eastern part of the county, those are the ones that particularly concern us because that is where many of the Aedes mosquitoes have been found.
Okay, I think before we move to the next group of panels, again, I would like to thank everybody. I'd like to just, probably the most alarming slide I saw was the one that you presented about the animal that kills the most. That was just, what is it, 760,000? What was the number?
Anywhere between 700,000, we have numbers up to 1 million a year.
Well, that is incredible. I never knew that fact, and that's actually kind of frightening. But thank you for it. Anyway, let me thank you for presenting today. If you don't mind, if there's further questions, we'll have you stick around, but we will get prepared for the next panel.
Thank you very much.
Hello. If we could get, my staff will put the next placards up. If we can get Kieran Saluja, MPH, RD, Executive Director of the Public Health Foundation Enterprise WIC Program, Laura Felser from the WHCNAP, Senior Director of Medical Services, Planned Parenthood, Pasadena and San Gabriel Valley, and Dina Steffens, Senior Director of Public Affairs, Planned Parenthood, Los Angeles. Well, good afternoon and welcome, and I appreciate your willingness to be here to discuss the Zika virus and the California's response. We're going to first start off with the first presenter, that's Kieran Saluja. Please proceed.
I want to start by echoing what the other gentleman said. Thank you very much for holding this session, and I appreciate the invitation. I have to say this is a little bit more formal than I thought, so I'll try and be a little more formal. It's very startling to me that I've been in this country for 36 years, and when I first came here, I was one of those mosquito victims because I came with full-blown malaria and spent my first 6 to 8 months in this country being radically treated after having several occurrences. So I know mosquitoes well, unfortunately, and I think everything that was said here, your use of the word alarming, I've been really alarmed about this since I first heard about what was happening in Brazil and so on, and working with WIC. We have really had our antennae up. So thank you for this opportunity to share a little bit about what we do and what we're doing about getting the word out to a lot of people who come to the WIC program. So Dr. Schwartz, WIC is a big place. So we'll talk about it. I am not going on the assumption that everybody knows about WIC, so there's one slide that tells you really quickly that the WIC program is a USDA-funded special supplemental nutrition program for women, infants, and children. Because it's such a long, complicated name, we've called it WIC. And we serve pregnant women and women who are postpartum, children and infants, and the children stay on the program till they're 5 years of age. You have to meet an income guideline, which is 185% of poverty, and you have to have a nutrition risk, which if you're poor, you have a nutrition risk. We provide nutritious foods. I always tell people, if you don't know what to eat, eat like WIC, because that's all you get is healthy foods. And we do nutrition education. And because we do these group sessions and individual sessions and online education sessions, it gives us this absolutely amazing ability to get messages across to our participants in a very quick and effective way. And it is supposed to be nutrition, but hey, if you don't have this all fits into it, really. We do a lot of breastfeeding support, and one of the things we're looking at now and reading up on what the WHO guidelines are is what about transmission through breast milk? That is still an unknown, and the WHO is kind of saying you need to keep breastfeeding because we really don't know if Zika gets transmitted by breast milk. So we get affected on all fronts. And of course, we are the ones who refer masses of people to healthcare, referrals to housing, domestic violence. WIC is sort of the hub for referrals. 211, I think we closed down the system if you put the word out. So this is really our population. This is who we serve. We serve the infants and the children and their mothers before they're pregnant, and afterwards, if they breastfeed, they stay on for a year. And I don't know if you all know this. This is pretty startling that 1 out of 2 babies born in this country is a WIC baby. It's a great cocktail party starter, I'll tell you. Everybody looks at you and says, "Are you drunk?" I'm like, "Not yet." This is a fact. This is America, and we have 1 out of 2 babies on a program that is a means tested program for low-income people. It's really sad. But I'll tell you one more thing that's startling. I think Dr. Gunzenhauser mentioned 125,000 births in LA County. In LA County, we serve 69% of the infants that are born in this county. So that's pretty amazing. Thank God there's WIC. Too bad there's so many kids who get on WIC. Nationwide, currently we are serving about 8 million participants, and this profile kind of shows you the vulnerable categories. It's 52% children throughout the country, 24% infants, and 24% women. So when you look at those numbers in that little block of women, and you look at how many are pregnant, throughout the country, it's 805,000 pregnant women, 591,000 breastfeeding women, and 75,000 non-breastfeeding women. I mean, we've got everybody. I'm sorry, 575. I can't read from here. I should look at my own notes. In LA County, what's interesting about WIC is that there are 7 different local agencies that provide WIC services. There's Antelope Valley has their own program. Northeast Valley Health Corporation runs a program that has about 60,000 participants. We've got Pasadena WIC. The city runs the WIC program. It's a small program, but significant. And then I am part of the PHFE WIC program, and I'll tell you about that in a minute. We also have LA Biomed that runs the program in the South Central area, and their caseload is also about 98,000. We've got Long Beach, the city runs the WIC program there, and then Watts Healthcare Foundation runs a WIC program for their folks. So a little complicated, but we work very well collectively, and the good thing is that we have a wonderful data sharing agreement that has been funded by First 5 LA, and so we do have data on all LA County WIC participants. It's a year later, so this data is from last year, where in LA County we were serving about 514,000 participants. Our breakdown is a little different than the national breakdown. We have more children, and 19% of our population are infants, and we have 20% of them are women. But 106,205 women are getting WIC services in LA County. So therein lies, where do you go to spread the word? You come to WIC. I am part of the Public Health Foundation WIC program. Public Health Foundation is a nonprofit that serves as our fiscal sponsor and is our umbrella agency. We've been providing services in Los Angeles for the last 40-some years. We went into Orange County about 15 years ago, and now we have a site in San Bernardino as well. So 53 sites altogether, 46 of them are in LA County. We have 150 nutritionists, 100 of them are dietitians, and 475 other staff. So I have a staff of about 625. Current caseload is 272,000 and change per month. So we see lots and lots of people every month. So we got really concerned about Zika when the news started coming out. And when I met with my team, I'm like, we got to get the word out. At that point, we didn't really know where to look and how to look. So we went to CDC and we started displaying this flyer at all our WIC sites. So it was mounted at front desk as you walked in, it was mounted in our classrooms where people sit and, I can't tell you that a lot of conversation was generated. It was our way of just raising the issue, telling people about what was going on. And the basic alert was about watching out where you travel. So sort of the same things that everybody's talked about. And then in June, we kind of stumbled across this slide. I have to tell you that in LA County, we do things a little bit differently. WIC is sort of not as part of the county. So perhaps we could communicate better. Definitely we could communicate better. But we found this, and this alarmed us even more as we looked at this silly Aedes stupid mosquito and all the places it is in LA County. And these are all the places our WIC participants live. So we wanted to really step it up. And we started a new program of something called Take a WIC Pic, where 97% of our participants now have phones, smartphones. And it's hard to remember the information when you leave. So we have that little icon of that Take a WIC Pic. So we updated our virus alert poster, and we encourage people to take a picture and take it back and share it with their families and friends. We now have a lot of material available from the California Department of Public Health, and CDPH is who administers the WIC program throughout the state of California. They have recently reached out to us and kind of shared with us all this different information, all the tools. I have to tell you, I was running late, so I have all these posters. They're really lovely posters, but they're lying in my car. So, sorry, I can get them for you later. This is the page on one of the pages of CDPH just to kind of show you. And then I brought a couple of these to show you what they look like. So there are these flyers, and they're also a really big size, which we're going to be using as poster size. One talks about Zika and pregnancy. They're only available in English and Spanish right now, but I know the CDC site has posters in other languages. And then there's one on Zika and travel. And there's a big one on Zika and sex, and this is the one I wanted to show you both in English and Spanish, because we've really got to get this information out to people and fairly quickly. When you mentioned the 4 countries, I think you said Guatemala, Nicaragua, Honduras, and El Salvador, that's where my population comes from. My participants are from there. My staff is from there. Do they visit family? Yes. Do their families come and visit them? Yes. I mean, there is so much always, grandma going over, grandma coming over, somebody, funeral, as you mentioned, people go for joy, people go for sadness. There's a lot of traffic. We've got to get this word out, and quickly. This is another flyer that's off of the CDPH website. So there's good material there. I appreciate that LA County has shown some material to us also, but I wanted to just share this with you, that if people want to go then get this, you can go to the CDPH website and also to, of course, the CDC website. So what are we doing? So we started off with, we're doing a big staff education in October. We have been doing minor education. I will not say we've been doing it on a full-blown scale because we have a lot of WIC things we have to do. But we do have an intranet that's very robust, and we put up online training for our staff to take, and then they have to pass the test after that. And then we kind of don't spare people when they go to the bathroom, so we have these things called installments that are up in every stall. So, you're kind of confronted with it when you sit down, so you have to read it, and we kind of think best way to get education across to staff. So this Zika installment is going to be going up and staying up for a little while. We're also training them on talking points so that our staff is able to respond to questions like, what is Zika? What should you know about Zika? What if you're planning pregnancy? How you can all help keep California moms and babies safe from Zika. After I've heard about vector control, I want to know if they can take lots and lots of calls, because that's something we'd like to tell our people. I'm sure you appreciate that WIC participants probably live in the highest risk areas for vector spread. Standing water. I mean, you've all seen the state of the streets and the, apartment housing. There is so many high-risk areas. So I'd like to let everybody know, get vector control over and have them look it up and spray the place if you need it. We also have a lot of attention now being given to this topic nationally. The National WIC Association, which is a nonprofit education and arm and advocacy voice of WIC, is holding this big webinar where they're going to have a CDC epidemiologist, and that's on September the 29th. Anybody can hook into that. So if there's any interest, let me know, I can pass it out. So bottom line, as I see it, I absolutely see that we are a very obvious setting to get the word out and to do a really thorough job about working with Zika. It's our moms. I've heard you all talk about microcephaly. Hearing those babies cry, that's one of the things that has haunted me when I first started hearing about this. The babies born in Brazil, and NPR would have these stories about these mothers, and these babies cry all the time. I mean, the human toll is so intense. We've got to do everything we can to prevent even one case of this happening. The suffering is intolerable. I cannot imagine something worse on a new mom. Again, you know who we see. We've got family members who come in instead of the pregnant mom. Sometimes it's parents, grandparents, foster parents. Everybody's coming in. WIC is really trusted and a very respected source of information. Really, when WIC talks, people listen, except about nutrition, because then Burger King talks and they listen, so that's a different issue. We also do everything in very many different languages. We have 7 threshold languages, and we usually translate our own material. We can actually probably help with translations if needed, so it's Korean, Armenian, Chinese, Vietnamese, Arabic now. We've got a big Arabic population, and of course, English and Spanish. However, there is an interesting issue that I'll reach out to all of you. We've had a steep drop in participation, so we can only reach out to people who come to us. And when the baby turns 1, because of our food package being so healthy and being restrictive, we don't really find a lot of people coming back. Well, most programs in the LA County area are only serving about 80 to 84% of their assigned caseloads. So we're missing out probably, tens of thousands of potential families who could be getting WIC services who are not coming back. So essentially, I would appeal to all of you is, yes, WIC can help with Zika. Let's help WIC get people back in. And any of you who are here from agencies, or if you have affiliates, you should be talking to people. Are you in the WIC program, or why aren't you going? Because it's not just the food benefit, it's all the education. And it's a place that you can get so many referrals and resources and help. And now, Zika information. So what are some next steps? I think we really need to work closer with the Department of Public Health and get the word out. We have a history of working with LADPH, with their nutrition area and chronic disease area, really. We've done nutrition messaging around specific topics. We've done it twice this past year, where all 7 WIC programs got together on the same page with LADPH, and we put out this nutrition message. One of them was about Not My Kids. It was a class about preventing childhood obesity. It was a really good effort, and we're doing something right now where we're talking about something about Be Better. Again, how you can be healthy, but our participants, over 500,000 of them, hear the message in WIC, they go out there, they see the message elsewhere, they go to their provider, they see the same message there, and we all know you have to hear something, 7 times before it even sticks remotely. So I think collaboration is the way to go, because reinforcement is really crucial for retention. What are some other potential steps? We do have the ability in my program, because we have a big texting platform. We can text messages to WIC participants who are enrolled in this opt-in system. It's approximately about 100,000 of our participants are enrolled in that. We're trying to get those numbers up. Again, a really good way of quickly getting a message out. What we do it really to remind people to come in, to see what we can do. And then you all mentioned media. I honestly have to tell you, before this, yesterday, I walked around my office. I talked to a bunch of people who work info and referral, a couple of other staffers, and said, "What have you heard about Zika?" And I'm really sad to tell you that I was met with a few blank stares. And I'm like, isn't there anything on your media? I mean, if you're watching Spanish language TV, aren't you? Is there? Well, maybe it's the news, but who watches the news? I'm like, okay, well, that's probably a good thing, because the news will keep you up all night, but sometimes you should watch the news. So we've got to, I've got football. This is not the Raiders, but maybe we need to have something happen. Everybody's going out to see the Raiders. They need to do something about Zika. So I think we need to really look at partners out there who can help spread the word that is not the usual. I respectfully will say this. I think it's a great idea to have this, but look at us. Look how full we are, right? So it's not sexy until we make it sexy. And I think we can if we get the right partners, because it's extremely crucial. So with that, I just want to really thank you and say, that's who we see. Lots of pregnant bellies and lots of babies. So thank you for the opportunity, and I hope we can not get this blessed thing in this county.
So the message is to make Zika sexy? Is that what it is?
The message is to make Zika prevention sexy.
Perfect.
That's it.
I like that one. Okay. All right, we're going to move on to the next panelist, Laura Felsker from the Senior Director of Medical Service, Planned Parenthood, Pasadena and San Gabriel Valley. Welcome.
Thank you very much. So thank you for the invitation to speak today and address this issue. So talking sexy, or I think that certainly moves into our realm as Planned Parenthood affiliates, and dealing with women of reproductive age and their partners that we see on a daily basis, and also dealing with STI prevention and treatment in those patients, along with ensuring that they're achieving their reproductive life plan. So what I'd like to address today is what Planned Parenthood's response has been to Zika virus. Nationally, there has been a response from the Federation out of New York and guidance that's been provided to all affiliates on how to address this problem with patients and get the word out, because we see that as one of the most critical things to be doing. So regarding Zika virus in the San Gabriel Valley itself, we are affiliate of only 4 health centers, but we provided over 55,000 patient visits last year. We encompassed a community of 24 cities within our area of the San Gabriel Valley. And as has previously been mentioned, the Aedes mosquito has been isolated in the San Gabriel Valley, and there have been infections in the San Gabriel Valley. So 90% of all of the patients that we see are almost exclusively women of reproductive age, the average age being 18 to 24 years of age. And also then the additional 10% of patients we're seeing are men who are capable of, creating pregnancies and are of reproductive age also. So, we look at ourselves certainly as reproductive healthcare specialists who are addressing the needs of reproductive life planning so that women and their partners can plan to have healthy pregnancies, healthy outcomes, and ensure those outcomes for their children as they grow, and also to be able to provide education and STI education for prevention. So because Zika has been now identified as being sexually transmitted also, we feel it even more critical to be getting that word out, even though we ourselves do not provide prenatal care in our affiliates. So I had the opportunity just on Monday to attend at the Keck School of Medicine the Zika presentation, and there was great information that was provided there. And one of the emphasis has been that how very important it is, even this through CDC recommendations, that every patient be talked with about their reproductive life plan and helping them achieve that in the best way possible. So again, that they can plan when and if they want to have a pregnancy and ensure that healthy outcome again. So as the slide there says, that reproductive life planning, the purpose of it is to help ensure planned healthy pregnancies with positive birth outcomes and support the overall health of well-being of both women, men also, and their families. So when we talk about reproductive life planning, what it actually involves is actually starting with one very basic question, and that is, are you planning a pregnancy specifically in the next year? Because we want to address issues around proper nutrition, avoidance of harmful substances, cessation of tobacco use, healthy eating, folic acid intake. And again, being able to then identify these patients that are planning this pregnancy, also then to be able to incorporate in that discussion avoidance of Zika virus and the outcomes of that. So with that question then, with an answer of yes, we will go to providing preconceptual counseling. If the answer is no, the patient, then we talk with them and use motivational techniques for LARC methods. LARC methods being long-acting reversible contraceptive methods that are much more effective in preventing unintended pregnancies than methods that are reliable on the patient's proper use of the method, whether it be remembering to take a pill every day, change a patch every week, etc. So when we talk about the motivational counseling and our LARC methods, we talk to patients specifically about the use of IUCs and the use of the implant, which are methods that the patient isn't required to think about for them to be effective in their use. And then their range of effectiveness is based on the method specifically that they're choosing. So the patient education that we are providing within our affiliate is that in identifying a patient who is planning a pregnancy, is that we have a specific information sheet that has now been revised 3 times based on the changing information, and talking about what they can do to prevent infection and avoid travel. We're providing this information sheet to all patients who come in for a pregnancy test with a positive pregnancy test. We're providing it to all patients who may be coming in even with a negative pregnancy test but are not wanting to be pregnant or not using a reliable method of birth control. And we're also providing it certainly to anyone who's asking. Again, also talking about the reproductive life planning, then using the motivational counseling techniques for the LARC methods, and advising all patients about the importance of consistent condom use. And because sexual transmission based on sexual preferences, it's been, as was previously reviewed, isolated in semen up to 180 days at this point after infection. And so very critical to prevent that spread from partner to partner if one partner has been infected. And because, again, as it was also stated, patients typically often don't experience symptoms and would never know they're infected, using these preventative measures way before a pregnancy would ever occur is very critical in that planning of a healthy pregnancy, because we still know that 47% of all pregnancies in the U.S. are still unplanned pregnancies, even with the effective birth control methods that we have available. So again, just as this picture demonstrates, we offer different IUDs that are extremely effective, as well as the implant. These are upwards of 97 to 99.5% effective when inserted at the proper timing and there isn't already a pregnancy in place, and require no further remembrance from the patient about how to use them properly. We also utilize, although this may be a little difficult to see on the big screen, a birth control menu to really help patients understand the effectiveness of different methods, also understand how the method is correctly used to prevent pregnancy, along with what the benefits are and what the possible side effects may be. So they can really see in a progression of the most effective to the least effective methods of birth control. And at the same time, also on the flip side of this, same menu that we utilize, it does speak to abstinence, because certainly abstinence is the one way of preventing an unintended pregnancy, and it's extremely effective. So when we talk about our preconceptual counseling model that we're using in those patients who are planning a pregnancy, we've identified that there are 3.8 million women of reproductive age in Los Angeles County. And again, as I said, 40% of pregnancies that do occur are still unplanned. And so that's why it's so very important to be speaking with women way ahead of time about the risk of Zika infection and how to avoid it. And as was previously said, talking with them, avoiding travel to areas where there's known Zika virus outbreaks, and also advising female patients about the use of, as was said previously, using condoms for 8 weeks after a partner has traveled, whether or not there's actual known exposure or infection. I'm sorry, let me back up for a minute. Using condoms for 8 weeks for a woman who has potentially had exposure by traveling herself or has been infected. But very important to also advise them that for a partner who has traveled or possibly be infected, that again, deferring pregnancy, as far as we know at this point with the information we have, at least beyond 6 months, because of the potential for there still being infection that's in the semen that could cause infection then in the mother. When attending the conference the other day with pregnant women who are infected in their pregnancies, it was Dr. Diana Ramos with the Division of Maternal Child Health who cited the most recent statistics from the CDC that it appears that there's a risk of 1 in 3 vertical transmission in those infected mothers to their infants. However, those infants may not necessarily have any congenital symptoms that develop. I think it's also very interesting to remember that this is one of the first diseases identified in the last 50 years that has been shown to prove congenital abnormalities in the fetus. And the last was rubella. So the importance of addressing this in women of reproductive age, again, is just critical. So I thought this was a very powerful example. This is actually a billboard that was sponsored by the AIDS Foundation in the Miami-Dade area, calling out to the public how very important it is to use condoms to prevent transmission. And getting the word out, I think, is absolutely critical, involving media, involving education of patients, any avenues we can to spread the word. So, I'd like to say we are definitely in this together. It's going to take a team of all of us collaborating. The CDC has a wonderful website that is updated continuously with statistics, but also an information sheet about providing reproductive life planning and questions to use and how to navigate a patient through that. There are downloadable posters that speak to travel advisories and everything else, so I would suggest checking out that website. Thank you.
Thank you. We're going to move on to Dina Stephens, Senior Director of Public Affairs, Planned Parenthood of Los Angeles. Welcome and thank you.
Great, thank you. And thank you, Senator, for your, not just this panel today, but for your longstanding commitment to public health access. I am, envisioning all the flower pots and things in my backyard right now that mosquitoes may be breeding in. So thanks to my fellow panelists who have put me in a state of panic. So much has already been said about Zika, its transmission, what's being done, so I won't take too much time, but I do want to share a little bit about what Planned Parenthood specifically is doing to get the word out into the community. A few people mentioned that it's fantastic when we have these infrastructures set up, like WIC, for example, a great organization where women can come in and get the information. But a huge challenge is the people who aren't coming in anywhere, and how do we reach those folks? And so Planned Parenthood is sort of uniquely positioned to be a real partner in this work for several different reasons. I love the idea of making Zika prevention sexy, and I think that's really our ballywick there. So we talk about sex all day, every day at Planned Parenthood. There's not many organizations who are sort of as comfortable talking about this potentially difficult, awkward conversation as we are, as our educators are. People trust us to have this conversation with them. We talk about sexually transmitted diseases on a daily basis, and Zika is one of those now. So we're already used to it. We have the trusted brand. We're a provider of prevention services. I know the CDC is recommending that the number one thing that we can do to prevent Zika pregnancy complications is family planning and access to contraception, and that's what we do. At Planned Parenthood Los Angeles, we have 20 health centers around LA County. We see over 250,000 patient visits every single year. So we have a lot of people coming in and out of our doors. We're making sure they get access to that birth control that Laurel, my colleague from Pasadena, just talked about. So we are a healthcare provider first and foremost. We're also educators. So we have an army of educators every day in our communities. They're in our schools, they're in our neighborhoods, they're at bus stops, they're at churches, they're talking to other professionals like social workers, nurses, counselors, teachers, educating them on how to talk about sex with their populations. We can easily flip a switch and talk about Zika, and it's in the same vein as we're already discussing in terms of prevention measures. So we have a unique infrastructure ready to be able to do this. And so I'll share with you what my colleagues in Florida are doing. Florida, obviously in Miami-Dade County, is the first area in our country to be impacted by the virus locally. And so our colleagues in Florida were ready to do whatever it took to get the word out. And so for the last 6 weeks, and they'll continue through September, we've had boots on the ground there going door to door, having conversations with people in the communities that are difficult to reach traditionally about Zika. And we're getting a lot of the same responses. It is surprising how few or how many people do not know about Zika or the potential risks. So you have a Planned Parenthood volunteer or staff person showing up on your doorstep. You may be in a medically underserved area. You may be in an area where this, dreaded Aedes mosquito is living and breeding. Knocking on your door, asking you some personal questions around your family planning. Are you pregnant? Are you planning to become pregnant? Are you sexually active? And, not many people can have that conversation. I think Planned Parenthood is playing a unique role there. And if someone is planning to become pregnant, great, congratulations. Let me educate you about the risks and make sure that you're connected to services to make sure you stay free from the virus. And if you're not planning to become pregnant, also great, we can help you make sure that you do not become pregnant unintentionally, and let's get you connected to some contraceptive services. So we're reaching 25,000 doors in Florida, and next week 2 of my staff are going down to Florida to actually join the program to learn, because as a few of my colleagues mentioned, we hope we don't have to implement a massive outreach strategy here, but we might, and we want to be prepared. And so our teams are going to learn from our colleagues in Florida, bring that information back here, and be ready to implement a similar project should we need to. And I will say that I recently learned from the same conference, I think a few people mentioned that, I believe El Monte, which is in the Senator's District, is anticipated to be particularly impacted by the virus. Shares a lot of the same qualities as some of the communities in Miami, lots of travel back and forth to see family members from different countries, some medically underserved communities, and we have a health center in El Monte, so we are gearing up. We're doing testing for Zika in all of our health centers. When women come in for pregnancy tests, we're able to test them and make sure they get connected to the right services. So we're excited to be a partner in this. I think I'll just quickly address what might potentially be the elephant in the room around Planned Parenthood and Zika, is that I think it is a disappointment to all of us in this room that there hasn't been more resources devoted to Zika prevention from the federal level, and it's frustrating to see funding for this critical care be held hostage yet again to the debate around Planned Parenthood and abortion. And so I think we're hopeful that we can eventually move on from this and make sure that we can be a true partner in these efforts, and we're ready and eager to do so.
Thank you. Was there any questions from the audience? Because I think any cards, if you want to put your hand up, and we'll get staff to pass it around again. Right over here. I have a couple questions. First of all, let me commend all of you for the work you do with regard to trying to educate the public. It's very clear that you do. I want to follow up with you, Dina, on the testing for Zika. So when a patient comes in, they're pregnant or they're thinking of getting pregnant, do you automatically test every patient for Zika, or do you ask them, and is it during the conversation that you talk about it that you ask them to be tested for Zika? What happens?
And Laurel, feel free to jump in. She has more of the clinical expertise, and I can speak for Los Angeles. At this point, I don't believe we're testing each and every person who comes to us for whatever myriad of reasons, but we are asking some of those screening questions to better understand if they're at risk, and to better understand if they are planning to become pregnant. And we do have the testing available on site at all of our health centers at this point.
Okay. Open question with regard to education. I'm assuming there's multilingual information, and if that's the case, how do you present that to the patients or the constituents that come in?
Right now, we're using the material that's available from CDPH, which is English and Spanish. We are looking at the CDC site to see what we can use from there in the other languages, and as needed, we will translate.
Right. Okay. I think one of the other alarming comments I heard from one of the earlier speakers was the percentage of Latinos that had the Zika cases within the area in the San Gabriel Valley. Are you seeing that as well, basically because of the type of patient you deal with, where they go back and forth to various countries, or maybe because it's the environment, more poverty-stricken, not as good mechanisms for, water and stale water out in the area? Are you noticing the same things within your facilities?
So we aren't identifying infected persons ourselves, but listening the other day to Dr. Ramos cite the 78%, they specifically in that conference related it to travel, specifically to those areas that have active outbreaks at this point.
So our patient population very much reflects the population of Los Angeles, which is largely Latino. And on the education side, we have a group of women called promotores. It's a model that's been adopted from Mexico and other South and Central American countries around educating some pretty hard to reach communities in the Latina population specifically. And I think it was Dr. Schwartz who mentioned that it's so impactful when someone hears from their neighbor, from their community member, someone that they know and trust. And that's what our model is. And this is Latina women who are mainly from different countries around the world who live in communities here who are Spanish speaking and who serve as community ambassadors within their own communities as a real resource. So they're actually sitting in a Zika training as I sit here to learn more about the virus and how that they can weave that education into their conversations that they're already having with their communities.
Thank you. Did we get the questions at all? Can we bring the card up? Sounds like a saxophone playing, doesn't it?
Mm-hmm.
So the question was, what efforts are being made to reach individuals who don't use birth control? For example, like Catholic Latinos.
I mean, that's a great question. I think, so, and I'm just sort of speaking off the cuff, but one of the beautiful things about our Promotores program is that they are members of their own communities, and that includes religious communities. And so we actually have quite a few Catholic promotores who have access to their own congregations and people of faith. And so I think for us, it's a matter of educating leaders within communities, and that's a great reminder to not forget about those communities that we may not already be reaching through our sort of existing organic reach, and to seek out some of those leaders who can help us spread the message within their own communities.
Thank you. That's all the questions I have. We're going to now move on to public comment. Was there anyone who would like to make any public comment whatsoever? Seeing none, again, I'd like to not only thank this panel, I'd like to thank the previous panel. This will be televised, I believe, through the Senate live stream. We'll also try to put it on our website, which will obviously going to be work with all the various entities. We're going to try to lobby the federal government to see if we can get more resources, see how we could come up with either a plan to look at resources throughout the state and as well as with the various counties. But anyway, with that, the meeting is adjourned.
Thank you.